Hello, everyone. Hope you're having a great day. Tatiana here with Speak for Joy, and I just wanted to take a few minutes to pop on to answer a question that was posed to me the other week. I had someone ask, what do you do and how do you determine the correct therapy approach for a voice client in particular? So there are two things that I ask. Initially, I want us to sit down and do a consultation session. And what that allows for me is to ask a lot of background knowledge questions, history, medical history questions to kind of get a holistic and a complete and comprehensive view of what you do vocally, whether it's in your professional setting, your personal setting, your social setting. And it helps me understand all of the various elements that may have led up to you seeking me out for vocal therapy. So when we sit down for this consultation session, I really just want you to kind of paint me a picture of everything that you do in a day, in a week, on a weekend, vocally. And so I'll ask specific questions like, what do you do when you're at work? Do you utilize amplification? Do you speak to a large group of people? Do you find that you're really yelling in order to get yourself heard? What do you do at home? Do you live with a noisy household where you're constantly speaking over multiple voices? Are you someone who on the weekend really likes to attend a lot of concerts, or you like to go to athletic games of any kind where you're yelling? Are you someone who goes to amusement parks frequently where you're maybe yelling? And then I'm also going to ask questions like, how much coffee do you drink in a day? Do you balance that out with water? Are you hydrated? What's your alcohol consumption? And again, are you balancing that with water consumption? What kind of medication do you take? And perhaps what are the side effects of that medication? Have you had any trauma vocally? Have you had any throat or face trauma? Have you had any recent surgeries that may be impacting your vocal function? All of this allows me to really gain that thorough understanding of all of the variables leading up to your vocal needs. After I get that background information, we do not pursue therapy just yet. What I'm then going to recommend is that you go and see an ENT. And an ENT, if you've never been to one, is a doctor that specializes in ears, nose, and throat. And what they're going to do is take a look at all of the internal anatomical elements that I can't see from the outside. So while I may be able to hear that your voice is strained or stressed or hoarse, or you have a gravelly sound to your voice, or your volume is in and out, what I can't see is specifically what is causing those issues with your voice. And so the ENT will look at things like look at inside your nose to see, are you really dry? Do you have a lot of postnasal drip? They'll look inside your ears to see, do you have issues with ear drainage? They'll take also a look at your throat, and what they'll do is they'll do a nasal scope. So they take a small camera and they pop it up your nose and down your throat. And while it's not the most pleasant experience, it really gives them a good view to see what's going on all the way up inside your nose, down inside your throat, and specifically your vocal folds. So they'll have you do things like say, ah, they'll have you cough, clear your throat, they'll have you try to say something with the camera down in your throat so that they can get a good view and see exactly what your vocal folds do with various functional demands. And that'll allow them to say, okay, I'm seeing nodes, I'm seeing polyps, I'm noticing one vocal fold is working more sufficiently than the other. I'm noticing that there's an abduction or an adduction issue. So that's whether or not the vocal folds close all the way or that they're not opening enough, all of those things. So without that information, if I were to recommend therapy, I could actually be doing more harm than help. And so you can tell me, you know what, I don't really want to do that. I'm not looking forward to having someone stick a camera up in my nose and down my throat. I just would prefer not to do that. And that's fine. That is absolutely your opinion. That is absolutely your option. I cannot force you to go and see an ENT. However, I will not service you as a client if I don't have that information. And it's really to protect you as the client, because I don't want to potentially recommend an incorrect therapy approach and do more harm than help. That's not what I want to do as a therapist. That's not my job as a therapist. So I hope that answers your question. So what I would ask is that we sit down and do a consultation, and then that I recommend that you go see an ENT. And once all of that is done and you want to come back, let's get some therapy started, and let's get that voice feeling the best that it can be so that you can speak the best that you can. Hope that helps. Thanks so much. Bye.